medically. So the blood vessels become narrow, and with time they can even get blocked. And when they get blocked, the portion or the brain or the heart that's supplying will die off. So that is where you can have a stroke. Person can have a stroke, or the person can have a heart attack. A major cause of dyslipidemia also, or high cholesterol, is consumption of ultra-processed food, which often contain what we call industrial trans fats and additives that injure the walls and then make it faster for the blood vessels to get blocked, narrowed, and get blocked. So what are the other causes of cardiovascular diseases in our environment? It's what I call other lifestyle factors. Number one, tobacco use. We've heard, the slogan, smokers are liable to die young. Why is this so? Because cigarettes can affect the walls or the vessels supplying the brain also, and especially the heart. One of the major drivers of heart attack in high-income countries like US and Europe is smoking, especially when you then mix it up with high cholesterol. And that is why in those environments, even at the age of 35, you see some people having heart attack. Age of 30 having heart attack because of heavy smoking and bad diet. So when you combine high cholesterol with heavy smoking, that person is liable to die really young because of cardiovascular disease. Apart from the cancers also, which the nicotine in smoke can give rise to. Other lifestyle factors are physical inactivity. So our people are becoming more sedentary, especially in the city places. So we drive to work, sit down at work, come back home and sit down watching television, and then eat, and then get back to bed. So there is no much activity. And the more people become physically inactive, the higher the blood pressure will go, the more obesity, the more diabetes will arise. Insulin will increase, inactive insulin will increase, or what we call hyperinsulinemia. Another factor under harmful, other lifestyle factors is harmful alcohol consumption, which is critical. Alcohol also can damage the heart, can damage the liver, can damage the brain. As a cardiologist, I see some of my patients coming in with heart failure due to excessive drinking because the heart has been damaged. So, to say a few things also under lifestyle, I mentioned nicotine before. That nicotine is something that should be avoided. That's why we say avoid smoking. There is no debate about it. High cholesterol, I mentioned it before, that is what can damage the wall of the blood. And ultra-processed food, they contain a lot of the trans fat, the very bad cholesterol, the hydrogenated cholesterol. So I want to conclude, or maybe let me summarize before I conclude. I want to bring out just 4 quick points, as a summary, then I will conclude. Number one, cardiovascular diseases, which include heart attack, heart failure, and stroke, a major public health issue, accounting for approximately 10 to 11% of total annual deaths in Nigeria. Hypertension is the number one risk factor and affects over 20 to 30% of Nigerians, and it can lead to stroke, heart failure, heart attacks, and chronic kidney disease. Other major risk factors for cardiovascular disease include diabetes, high cholesterol, what we call dyslipidemia, cigarette habits, and sedentary lifestyle. The fourth one is that all the major risk factors for cardiovascular disease are partly due to bad diet, from excessive salt to consumption of ultra-processed food. And the fifth one, which is the last one, for Nigeria to make advancements in the primordial and primary prevention of cardiovascular disease, we need structured policies to protect the population from excessive salt intake, trans fat, and ultra-processed food. So in conclusion, the burden of cardiovascular diseases is very high, and there is no way it's not linked to a poor diet that is becoming rampant in our society, and lifestyle choices, including sedentary habits and tobacco use. Once again, for Nigeria to make advancement in prevention of cardiovascular diseases, either primordially or primarily, we need structured policies so that the population can be protected, especially from excessive salt that drives high blood pressure, trans fat, and ultra-processed foods. Furthermore, we need robust health insurance to ensure the availability of affordable generic medications to manage hypertension, to manage diabetes, and to manage high cholesterol. Thank you very much.